John Kennedy, Professor Emeritus, University of Iowa Departments of Otolaryngology and Plastic Surgery, and former bass player, card-carrying member of the Iowa Musicians Union. Great, and John, do you want to describe what a cleft palate is and how it differs from the lip and its management, perhaps?
Sure, and thanks for providing this model, Harry. This is a cross-section, so if you slice the head right down the middle, this is what, and looked off to the side, this is what you would see. So these are the teeth, the nose, the top of your mouth, going back to the soft palate, and the uvula, the little punching bag thing in the back that everybody always talks about, your tongue, and then on down into your food tube or esophagus or your windpipe down to your lungs. Cleft palate has a split, usually at or near the midline, so there's a gap between the mouth and the nose. And the palate serves numerous functions, but in this context and in just normal everyday day-to-day life context, you need to be able to seal off your nose from your mouth. And you need to do that when you're drinking liquids or the liquids will come back out your nose. You need to do it when you're eating food or some of the food particles will come back out your nose. And you need to do it when you're speaking as well. And there are certain sounds in all languages that are specifically designed to come out just your mouth. There are other sounds that are designed to come out your nose, like 99 is a nasal sound. If you put your hand up, you'll feel the air come out with 99. Coca-Cola is a specific oral sound, 100%. So if you don't have your cleft palate fixed, or if it's not completely closing, a sound like Coca-Cola becomes Coca-Cola, where the air actually leaks out your nose. And obvious implications for playing an instrument. If you know, you're having trouble just with the breath support with speech, this is going to be incredibly difficult because the air will just leak out your nose and you can't build up the necessary pressure. There's a number of ways to do this, much like the lip. There is a mucosal overlay of the palate. The middle layer is muscle, and there are muscles that run in different directions. So part of the palate movement is just up and back, but part of it is also like a ring of muscle that constricts down in that area.
You're talking of the soft palate, not the hard palate.
Soft palate.
The non-bony area.
Yeah, the front part of the palate, good point, front part of the palate is bony, but kind of the action part of the palate is in the back where the muscle and the so-called soft palate. This goes up and the back wall comes forward, so it creates a tighter seal at that point. And you know, the ideal outcome for a cleft palate repair is to have be able to make that seal not only with speech but with any other activity that you want to accomplish. But you don't want it to be overclosed where it sounds like you have a cold or your nose is stuffy and air can't escape from the nose when it's supposed to. So there's kind of a sweet spot of palate repair and ancillary operations for that palate that puts you where your voice sounds normal, you can eat and drink without difficulty, and you know, if you want to, you can play a brass instrument too.
And what age do you do the palate repair?
So again, it depends a little bit on the presentation, the health of the kid, and the size of the defect. But usually that's all wrapped up by 18 months or within the first 2 years of life.
And then there's some ancillary procedures that I believe Killian had to try to close off that port when it doesn't close off on its own.
Right, and sometimes, you know, particularly with bilateral cleft situations, you're just maybe a little short of tissue even after you've got everything to heal up correctly. And so you can do a procedure called a pharyngeal flap, where you bring tissue from the back wall of the throat. So if you went and you took a pencil between your teeth and just went back until you hit the back wall of the throat, you leave that attached at the top and you can swing that up and add tissue in to the soft palate, kind of in the midline, and again, just make it that much easier to close off when you need to from leaking out the nose.
And what age do you do that?
So typically you do that when the patients have demonstrated they're having difficulty with those speech sounds. And that's back to, what we talked about earlier, where I'm not a speech pathologist, but, fortunately there were great ones when I worked over at university hospitals. And so they have a battery of tests they put the patients through, and we discuss it. And if it looks like that procedure would help their speech, then usually around 5, 6, about the time school starts, to let the kids participate in school without being teased about their speech. And also, there's a reason school starts at 5, because kids can cooperate a little bit more long term. They can participate in the speech therapy sessions in a meaningful way. So usually those operations are done around 5 or 6, and there's other procedures that you can do too that will address that same thing. But Killian had a pharyngeal flap.
So it's a long-term program. I understand you have a picture of Killian shortly after his pharyngeal flap. Killian, when did you start playing the trombone?
I started playing trombone when I was in 5th grade, so that's a long time to think about.
Do you recognize that picture? How old were you?
I do. I believe would have been about 5th grade. That would have been, I think, one of my first concerts, if I'm not mistaken.